Hi friends, I am Dr. Anunai Srivastava, consultant interventional cardiologist practicing in North Delhi. Today I would like to discuss pulmonary arterial hypertension, how it's living, and it's a chronic illness. Being diagnosed with the condition can really be distressing for an individual. It can be a complete life changer for an individual. The burden with the patient carries due to PH is huge, and definitely it continue to be progressive disease and associated with higher mortality and morbidity. What causes the pulmonary arterial hypertension? Exactly, the cause is difficult to find. It ultimately damages the blood vessels of the lung and become thick and narrow, which result to pulmonary arterial hypertension. And in PA, the pressure in the right side of the heart is increased very much up to suprasystemic level, and it has to pump against it with the much higher pressure who have pulmonary arterial hypertension from the other causes. The symptoms are increased shortness of breath, fatigue, edema, swelling in feet, legs, and eventually the abdomen, dizziness, faintness, chest pain, heart palpitation, lips and finger cyanosis. So, if there is no improvement in shortness of breath, even after taking medication and treatment for asthma and COPD, and if individual experiences fainting and chest pain on exertion, swelling in the leg, a feeling of tiredness, fatigue, you need to get in touch with the cardiologist. And the diagnosis of PAH gets difficult as ruling out other lung disease with a specific test is necessary. Sometimes like echocardiography and cath lab study are required. Doctor will recognize a specific diagnostic test that will help the diagnosis in the condition. Now coming to the treatment and management part of the PH, the definite treatment, there is nothing definite treatment of the pulmonary arterial hypertension, but with the advances in the medical therapy and procedures, slowing down of the disease can be achieved so that the affected individual is able to improve his quality of life. Individual need to be consulting their doctor very closely as the treatment and management modality varies from person to person. Your doctor will decide which treatment option works well for you. The distress of this condition is very troublesome. Patient needs a lot of support from their family, friends, and lot of expert advice to manage this. Regular testing, including echocardiography, 6-minute walk test, and medication on regular basis is required. And some of the lifestyle changes like quit smoking and avoiding passive smoking. Even though you feel tired, try stay active, and suitable exercises plan is required. We should avoid traveling high altitude, stay on healthy diet, and sure to take care of your mental health. And living with PH can be a roller coaster ride, and early diagnosis can be helpful, and treatment initiation at an early stage will limit the progression of the disease. Thank you.